Hi, everybody. My name's Kevin Rogols. I'm the Chief Executive Officer at KMHC. I've been here now for 11 years, and throughout those 11 years, we have worked very, very hard at KMHC to improve the health and the quality of life of everybody that we serve throughout the region. I've been blessed being here, and I hope that we have met your expectations, and I hope that you have seen growth over the past 11 years. We've been on a journey that began in August of 2022, well over 2 years ago. And that journey really wanted to answer the question, how can we position ourselves to best meet your expectations, to improve the health and quality of life of those we serve over the next 70 years, as we have over the past 70 years. We've asked lots and lots of questions, and we're looking at the structure of KMHC so that we can, again, best meet your needs and expectations. For us, this is all about service. This is all about being able to continue to grow, to add services so that you can get service locally, so that you don't have to drive 45 minutes one way or even an hour one way. In bad traffic, the week of 4th of July, we think that our community deserves to have healthcare, the best healthcare provided locally, and that's what this journey is all about. To that end, we have evaluated the structure of KMHC, and we've identified that there's a better structure. There's a structure that gives us the flexibility and the creativity to expand and bring higher level of acuity care right here to KMHC close to home. Now, it does mean a change. It means a change in the structure of KMHC, moving away from an Act 47 entity, right, a municipal entity that is governed by law that comes from 1945, to a modern not-for-profit that can actually respond to the challenges and the opportunities that are in the healthcare market today, in 2024. Now, you've got to admit that the difference in healthcare from 1945 to 2024 is significant. Nobody can argue that point, right? We're looking for ways that we can expand, and we believe at the hospital that a change in the structure of the hospital will actually help us do that. So there's been a lot of discussion out in the community about this new structure. The new structure is a membership-based 501c3 modern not-for-profit. Now, it's very unique. If you look at not-for-profit hospitals across the United States, not many of them have membership models. So why are we pursuing a membership model? Because it's what you asked for, right? The community was focused on how can we make sure that the hospital is going to meet our expectations, not the expectations of, a healthcare party 45 miles away or 2 hours away, right? It's the element of control, and we have truly created a very unique structure that carries forward that element of control that the Kalkaska County Hospital Authority has today and applied it to the not-for-profit, so that in the future we could never be sold to a health system, any health system, without the approval of today's hospital authority. Now, that's the ultimate reserve power. And why do we do that? Because we listen, and it's what members in the community were asking us to do. That's very, very important. Now, those of you who know me know that I hate politics. And I can tell you that at KMHC, we don't care what your politics are. You can be a Republican, you can be a Democrat, you can be an independent. We don't care. And if I've said this once, I have said this dozens of times. Politics have no place in healthcare. We're going to take great care of you at KMHC, regardless of what your political background is. Now, I can't say that everybody in the community agrees with this concept. And it's interesting because it's a very important concept. It's a very complicated concept. And we've been evaluating this for more than 2 years. And I want to tell you something. Every piece of data and information we have made available to our communities. Do you know we have had 52 open forums since the beginning of January? We've actually had, I think, like 48. We've got 4 more literally this week and next week. That's going to come up to 52 open forums, and we have given the community every piece of data that we have had, every piece of data that the board has had in order to conclude that in order to best improve the health and quality of life of the people that we serve, we believe we need to become a modern 501c3. Now, a big part of elections, quite frankly, are trust. Who do you trust? And I think that is very, very pertinent to KMHC as well. We have been totally transparent. We have provided articles of incorporation, the transfer agreement, preliminary draft bylaws, the analysis, the financial analysis, the structural analysis. We've brought all that information and made all that information available to the community. And it's interesting because we had a vote of the board, I think it was back in August, and the board voted 17-2 that they believe becoming a 501c3 not-for-profit is absolutely in the best interest of healthcare in the communities that we serve. We have a letter signed by every active staff physician at KMHC, identifying that they unanimously and unconditionally support becoming a 501c3. We have a very talented leadership team. We have more than 400 years of experience on this leadership team. And we conclude unanimously and unconditionally that this is absolutely in the best interest of the community and of healthcare over the next 70 years. So this is going to boil down to trust. Do you trust your doctor? Do you trust the board of KMHC? And by the way, we have 13 members of the KMHC board that are appointed by the townships. In the new not-for-profit, if you all agree and vote to approve the not-for-profit, the 501c3, we'll have 13 township and village elected board members, just like we do today, guaranteeing that the townships and the village will have a majority, 13 out of 21 board members on the new board, just as they do today, having 13 out of 20 members right on the board today. Trust, again, is very, very important. So let's look at how did the township and village appointed board members vote. There are 13 of them. 11 voted in favor, right, of the belief that becoming a 501c3 not-for-profit is absolutely in the best interest of the community that we serve and healthcare over the next 70 years. 2 did not. Now, I've been asked by many people in the community, why did the 2 not vote in support? And my answer to that is, you really need to go ask them. I mean, nobody can articulate their opinion better than them. But I can tell you, 52 open forums. I think when you're having a discussion in the community and when you're trying to decide who are you going to trust, I think you need to ask yourself who has the information, who has the facts rather than the speculation. And all the information we have is readily available. We'll provide it to anybody absolutely who wants to see it. And we have provided all the information that we have at each of these 52 open forums. But ask the people who you're talking to, have you attended an open forum? Right? There was a recent podcast and the presenter never participated or attended an open forum. And that's fine. You don't have to, right? But this is your vote. And that vote is going to come down in large part to who do you trust? right? And I think that's so important. Now, and all of you can make your decisions. We only ask that you make informed decisions. Whatever you decide, we absolutely respect your decision and we will abide by your decision. Thank you for your consideration, and my thanks to the best providers, the best hospital staff, the best board members, and the best communities that I've had the honor of working with in my 42-year career. So God bless all of you, and God bless KMHC. Thank you.